Well, good evening and welcome. My name is Justin Mills, and I will be your host and moderator for tonight's special feature webinar. We have a very interesting topic tonight that will offer tremendous insight for you and your personal health, and we're glad that you're able to join us here tonight. Well, our sponsor for tonight's webinar are two sponsors, Agri-Best Feeds. Agri-Best Feeds offers a unique line of livestock supplementation, distillers grain-based complete supplements, and sea salt for horses and cattle, and we welcome all of the Agri-Best Feed attendees that are also joining us tonight as well on our webinar. Also sponsoring tonight's webinar is Real Salt, full of flavor and natural goodness the way salt was meant to be savored. Experience the goodness of real salt, and we thank our sponsors tonight as well. Well, we turn towards the area of human health, and we are extremely pleased to have with us live and in person nationally renowned author and speaker Dr. David Brownstein, and we're pleased to have him with us tonight with a special presentation on his book entitled Salt Your Way to Health. Dr. Brownstein is currently the director of the Center for Holistic Medicine. He received his undergrad from the University of Michigan and his medical doctorate's degree from Wayne State University. He is a board certified in family practice and practices holistic medicine now for 12 years, specializing in the use of vitamins, minerals, herbs, natural hormones. He's lectured internationally about his success with using the natural items and has authored multiple papers and books including The Miracle of Natural Hormones, Overcoming Arthritis, Overcoming Thyroid Disorders, and Iodine, Why You Need It, Why You Can't Live Without It. But tonight, though, we focus on Dr. Brownstein's book, Salt Your Way to Health, as he discusses why salt is the most misunderstood nutrient and how adding the right kind of salt to your diet can help fatigue, adrenal disorders, immune system function, thyroid disorders, cholesterol levels, blood pressure, and much more. So with that now, I would like to turn it over to our featured presenter. Would you please welcome, and we're glad to have with us, Dr. David Brownstein, our presenter for tonight's webinar.
Well, thank you for having me here, Justin. Since you just gave my whole talk, I think I could bag out now and just take questions. But let me show you in these next 45 minutes to an hour why salt is such an important thing and how you can integrate salt in your daily activities to get the best effects for your health and your family's health, and why you need to use unrefined salt instead of refined salt. And I have written a number of books in my medical career, and I've written 9 books right now, and I'm currently working on the 10th. And this salt book is one of the most important books that I've written. And when I started doing when I became a physician about 20 years ago, I really wasn't interested in any alternative or holistic therapies, and I bought the party line that was taught to me in medical school, and part of that party line that was taught to me in medical school was that everybody needs to reduce salt, and that you're healthier if you don't eat salt, and you're unhealthy if you eat salt. Now, we were taught that from day one of medical school. We were taught that the last day of medical school. And pretty much every conventional conference that addresses the issue of salt still holds true to the idea that salt is a bad thing, and that the healthier you are, the lower your salt intake is, and that includes for everybody. But I will show you that that is just, part of the myth of salt, and really what I learned in medical school about salt is really not true or skewed for the truth. But in today's lecture, I will show you, what is the truth. So there's no better way to start than a quote from Leo Tolstoy, and he said, "I know that most men, including those of these with the problems of the greatest complexity, can seldom accept even the simplest and most obvious truth, if it would oblige them to admit to the falsity of conclusions they have delighted in explaining to their colleagues." Now, there really hasn't been too many more falsity of conclusions that have been stated about one single item than salt. And we'll talk about those myths tonight, and what's true with salt and what isn't true with salt. So this is my newest book, the second edition of Salt that just came out a few months ago. And in this book, I write about how salt can help with adrenal disorders and blood pressure problems. I'll show you in this talk that I put most of my hypertensive patients on salt, and that they need the right kind of salt, and the right kind of salt will actually lower the blood pressure. it helps out for fatigue and disorders with fatigue like fibromyalgia. It helps out headache patients. It helps out thyroid disorders and a whole bunch of other conditions. So I had been using, when I started doing holistic medicine 20 years ago, I quickly realized that the vast majority of my patients were suffering from vitamin and mineral deficits. And it wasn't usually just single vitamin and mineral deficits. It was a host of vitamin and mineral deficits. And I started to, when I started to draw blood levels and test levels of patients on these things and seeing just the sheer numbers of patients and the number of nutrients that were off kilter, I started to ask myself, well, how could this be? We live in the wealthiest Western society in the face of the earth. We have food plentiful. And my patients were either malnourished or undernourished, the vast majority of them. And even ones that appeared healthy were undernourished when I looked at specific nutrient levels in their blood work. Well, as I was starting to peruse the nutrition literature, I came to information about salt and how there was a big difference between refined salt and unrefined salt. And I didn't know this in medical school, and I learned it afterwards that refined salt has no minerals in it, while unrefined salt has over 80 minerals in it. And particularly from the mineral side of things, I realized that the vast majority of patients were undernourished or malnourished because they're not getting the right nutrients in their food, and one of the most important foods is salt. Well, I had been using salt in my practice for about 12 years when this article came out in the Detroit Free Press. And every Tuesday in the Free Press there is a section on health. And really there wasn't much about health. The section was truly about the latest and greatest CAT scan or MRI or drug that was coming out. But this woman, Karen Collins, who's a nutrition writer, always wrote a column and answered questions. So I was at this point on Thursday, September 28, 2004, I was busy writing my iodine book. And I was finishing it up at that point. It was ready to come out, and it did come out about a month after this. And I was just making the final changes to it, and all of a sudden this article comes out. And you can see from the question here, is sea salt more healthful than regular table salt? And she gives an answer, no. The two forms of salt are equally high in sodium, and sea salt offers no nutritional advantages. Well, I read that. I got annoyed about that. I cut this article out. I taped it over my computer so I could see it every day. And every day I saw it, I got annoyed. And as I was writing my iodine book, I knew what my next book was going to be, and it was going to be about salt and explain the difference between unrefined salt and refined salt. So whenever I give my salt lecture, I like to give thanks to Karen Collins because it was her article of writing this that really gave me the impetus for writing my salt book. So if she's listening, which I doubt she is, thank you, Karen Collins. These are the chapters in my salt book, and we won't go through all of these in the next 45 minutes, but we will cover what we can. And I will definitely give you an overview of the important points of salt, and we can certainly take questions as we're going on. I got a little screen here if you type in your questions and they come through, and I'll try and answer them as we go on. If not, I can answer them at the end of the talk. Now, you don't have to be paying too much attention to the mainstream media, whether it be TV or magazine or newspaper print, to realize that there is a call of late that has really gained steam behind it to limit salt in our food. And this was an article from the New York Times, titled "FDA's Urge to Set Limits for Levels of Salt in Food." And they're writing, the author of this article was writing that the high amounts of salt in supermarket and restaurant foods should be declared unsafe by the federal government, according to a new report by FDA. Well, we'll look at this data and see if it's really, if they know what they're talking about and if they're making correct statements about the levels of salt in food. This article from the Wall Street Journal, will low salt pretzels taste just as good? I highly doubt that. I don't eat a lot of refined carbohydrates in my diet, but I do like pretzels, and I really highly doubt low salt pretzels will taste as good. They need to use the right salt on these pretzels. And that's what they're not using, and I'll explain what I mean about that in just a second. So I call this section the myths of salt, and this is how I start off with the book, and I describe the myths of salt, and then through this talk we will dispel these myths of salt and hopefully make you comfortable with learning about what the right kind of salt is in your diet and learning to use the right kind of salt in your diet. So myth 1, there is no difference between refined salt and unrefined sea salt. That's what Karen Collins says. That's what the mainstream media says. That's what FDA says. And that's what the mayor of New York said when he basically made a statement to impose salt restrictions on the restaurants of New York City. Myth 2, a low-salt diet is healthy. We've all heard this. You've heard it on TV. You've heard it in print. You've heard it probably from your doctor. If you go to your doctor and your blood pressure is slightly elevated, the first thing they'll tell you is you need to eliminate salt in your diet. Well, I'll show you that that's a nonsensical statement because eliminating salt in the diet has very little change in blood pressure, even if we're talking about refined salt. And if you certainly shouldn't eliminate unrefined salt, which we'll talk about. And in fact, I put most of my hypertensive patients back on salt and see their blood pressure lower when they use the right kind of salt. Myth 3, low salt products are better for you. Well, that's certainly what the mayor of New York is saying, and FDA and the Surgeon General. But is that really true? And should we have more low salt products in our diet? I'll show you that is a myth that just is not true and is not going to improve our health, and in fact will worsen our health. So, myth 4, and the last myth I'll talk about here is if you have salt in your diet, you're going to get hypertension. That's what the AMA and FDA and the mainstream media want you to believe, and I'll just show you that it is nothing more than a myth. It's just a wives' tale that's repeated over and over, and somehow it's become truth in mainstream medicine just because it's been repeated over and over. I'll show you where that myth started, how it's got fuel behind it, and why it's not true. So let's start our discussion about salt. The first question is, what is salt and where does it come from? And all salt comes from the ocean. Whether we're talking refined salt or unrefined salt, it all had its origins from the ocean. Salt beds on whether we're talking about salt beds in Utah or salt beds in the desert, they all came from the ocean at some point in time. And as the waters receded, some salt beds were left behind. Of course, the largest supply of salt in the world right now is in the ocean. But there are salt beds all over the earth and under cities. And I live outside of the city of Detroit, and part of the reason the two reasons Detroit was founded as a major traveling stop as the U.S. Settled from east to west. Number one, because it was on water, and there was shipping lanes, and number two, it sat on a salt bed. And the human existence always moved to different areas depending on the salt source, because humans can't live without salt. Now, to discuss salt, you have to know the difference between refined or unrefined salt. And if you don't know the difference between refined and unrefined salt, I say generally whatever statement you're going to make about salt is an erroneous statement. So whenever I refer to salt to my patients, I use the term unrefined salt or refined salt to preface it. When I was writing my book, at some point in my book, I said from now on when I say salt, I mean unrefined salt. And then when I referred to refined salt, I would say refined salt. So I would suggest for the listeners, once you're educated on this topic, whenever you're discussing it with anybody, and if you have any questions for me, please use the terms refined or unrefined salt to tell me what you're referring to. And just because a salt is called sea salt doesn't mean that it's unrefined. If you go to the grocery store, you can see many types of sea salt, items labeled sea salt. Well, that means nothing. It all came from the ocean. It can all be labeled sea salt, and it doesn't mean it's an unrefined salt. So we have to really clarify what we're talking about with salt. Morton's table salt could label themselves as sea salt. Now, as I said, many sea salt products on the market are refined. These are devitalized products that should be avoided from the marketplace. You should avoid, that are available in the marketplace, and there's really no reason to use them in their diet for any condition. The earliest references to salt occurred about 5,000 years ago in China. 3,500 years ago, ancient Egyptians recorded pictures of salt production, and those pictures are readily available now. Salt has been part of the human existence since the beginning of time, and in ancient times, before we were able to move items around in an easy manner, humans would only settle where there were areas of salt available. Otherwise, they wouldn't survive. Paracelsus said the human being must have salt. He cannot live without salt. Where there is no salt, nothing will remain, but everything will tend to rot. So I think that quote certainly says it all about salt. And there's been ancient writings about salt in medicine, and it's really only the last 100 years that salt has been vilified as a faulty item that we should be avoiding in our diet. So, for modern times, salt's used for many manufacturing purposes. It's used for pulp and paper manufacturing, for soap, for dyes. It helps for clearing of snow and ice from the roadways, storing nuclear waste. They're always in salt mines, and it's used as a food preservative, at this point. So we have many uses of salt right now, and but we're going to focus on the medical uses of salt. So let's tackle myth one. There's no difference between refined table salt and unrefined sea salt. Most refined salt is harvested mechanically from various salt mines as brine, and brine simply means salt and water. This brine is treated with harsh chemicals to remove the minerals. In the literature for the salt manufacturers, they refer to the minerals as impurities in salt, and these impurities are removed and sold to industry as minerals for them to use, but they're really not impurities. They're what should be in salt. It's what our maker put in salt, and what we need as humans to get from salt. Now, as part of the manufacturing process, they use bleaching agents to improve the color. They use chlorine to make it white, and now they call it pure salt as the minerals are removed, and it's put in a fluidized bed dryer to make the dry salt that we're so used to having. And here's what you get when you use that, what I'm calling pure salt, and I'm putting my fingers up in a, in a mode that, I wouldn't call it pure salt at all. I would call it refined, devitalized, toxic salt. It shouldn't be in anyone's cabinet. And if you have this in your cabinet, or your children have it in their cabinet, I would tell you to remove it and put the right kind of salt in, which we'll talk about. So again, from the New York Times, cutting back on salt could save the U.S. billions. The study said reducing daily intake to 1,500 milligrams may save $26 billion in healthcare costs. These numbers are picked out of the air, folks. It's like the Wizard of Oz, and the man behind the curtain. It looks like big numbers. It must be true. They're stating it, and there's big headlines. It's in every paper. Your doctors are saying it. I'm telling you, it is the Wizard of Oz. It's not true. And we need Toto to pull the curtain aside so we can see the truth behind this, and I'm going to help you see that truth behind it right now. The true headlines should have said, cutting back on refined salt could save the U.S. billions. I would totally agree with that headline, and tell you that that's what the focus of the story should have been. But the authors of the story don't know the difference, and unfortunately most doctors don't know the difference between refined and unrefined salt. From the Wall Street Journal, smack is bad, but the crackdown is on salt. And he was basically just writing this article about the mayor of New York saying that he wants to limit salt in restaurant foods in New York City. Now, from the National Academy of Sciences Food Chemicals Codex Sodium Chloride Monograph from 1996. This is what the salt manufacturers use to make their salt. For their guidelines, they say up to 2% of food-grade salt may contain anti-caking, free-flowing, or conditioning agents such as sodium ferrocyanide, ammonium citrate, aluminum silicate, and dextrose, which is a stabilizer to hold iodine in salt. Dextrose is sugar. So think about it. In that can of Morton's table salt is up to 2% of sodium ferrocyanide, which is a toxic item that shouldn't be for human consumption. Ammonium citrate, maybe that's not a toxic item, but that shouldn't be for human consumption either. Aluminum silicate, there's no reason for that to be in anyone's food supply. You know, we certainly don't need dextrose in salt. That's not a naturally occurring unrefined salt. So here's what's in refined salt. 99% sodium and chloride, up to 2%, as I mentioned before, ferrocyanide, aluminum silicate, ammonium citrate, and dextrose. And, you know, a small amount of iodide. Now refined salt, because it have all its minerals removed, remember, industry calls these minerals impurities in salt. Having all these minerals removed, refined salt is a lifeless product. One of the reasons the industry does this is to ensure a long shelf life. It has nothing in it that can go bad, and it can sit on the shelf literally forever. That's the reason they refine flour, and they refine oils, and refine sugar. They take out the items that can actually spoil, which are the natural items that naturally occur in these food supplies. And these items can sit on the shelf for a long time, but certainly maximizes profits for industry. Problem is, it's not good for us to eat this stuff. Now, what are the problems with refined salt? Well, as I mentioned before, it's an unnatural product. The human body has not seen refined salt except for about the last 100 years, or a little bit less than 100 years. So in the whole hundreds of thousands of years of human existence, human beings developed, human beings were designed to use refined salt. Our bodies aren't even ready to use, our bodies are developed to use unrefined salt. Our bodies aren't designed to use refined salt. We're not genetically programmed for it. This is a big experiment we're doing on everybody. Now refined salt, as I mentioned before, lacks the minerals. It's only got sodium and chloride in it and added iodine. All the other 80 minerals, or the impurities as the food industry says, are gone from it. And I've said before, humans do not evolve using salt as sodium and chloride only with toxic substances added. Humans evolved over time using natural unrefined salt with its full complement of minerals. So, from the Wall Street Journal, that wasn't supposed to show up that fast, but the title is Too Much Salt Takes, I got a little box over my finger, it takes a blood pressure toll. And again, the headline, if it was appropriate, should have said, too much salt, too much refined salt takes a blood pressure toll. And there's no question that we are probably getting in too much, well, any refined salt is too much salt. We've not been designed for this. We're not used to this, and there's our bodies don't know how to respond to it. Unrefined salt has not been put through various machines. It's not exposed to harsh chemicals such as chlorine and acid. And unrefined salt is a nutrient-rich product that has a multitude of benefits for the body. This is what we should be. This is what we should be eating. This is what I recommend for my patients. This is what I would tell you to recommend for your families, for your grandkids, for your kids, for your parents, whoever. This is what humans should be eating. Actually, this is what animals should be eating as well. You know, animals didn't grow up on refined salt and didn't reproduce with refined salt. Their genetics are programmed for unrefined salt. You know, I've got these little questions over here. I'm trying to see them, so I'm having trouble seeing them. But if I don't get to the questions during this talk, I promise we'll get to them, you know, at the end of it. So Redmond's real salt is an example of a very good unrefined salt, and it's harvested from underground mines. Its salt retains its unique mineral content from what was naturally put in it by our maker, and I've had it tested 4 separate times. It contains no amounts of heavy. Maybe I shouldn't say traces, but it contains no appreciable amounts of heavy metals. It's been a clean salt tested 4 times by me. I've used it in my patients and had very good results with it. There are other salts out there, unrefined salts out there, but Redmond's has proven to be a very good salt, and it's got a long place in the marketplace, a long time in the marketplace. So let's do a comparison of refined salt versus unrefined salt. And you can see here that 99% of refined salt is sodium and chloride, and then up to the 2% of the toxic elements added, where the amounts are very different in the unrefined salt. You have 83% sodium and chloride, and the big difference is up to 2% of trace minerals. And depending on the salt and where it comes from, maybe 14% of moisture. But it's really, the difference is in these 2 categories that make the problem salt and the not problem salt. So here's just a chart that I have in my book of the major contents of Redmond's unrefined salt, showing magnesium and potassium and calcium, significant amounts in the salt, and all these good items have been removed from the refined salt products that are out there. The pH refers to acidity and alkalinity, and a neutral body pH is about 7.2. And all items in the body function better at a neutral pH. That includes organs function better at a neutral pH. Enzymes work better at a neutral pH. Vitamins, minerals, immune system cells, etc. Everything in the body functions well at a pH of around 7.2. And I frequently have my patients check their pH with pH paper. And I have them do salivary pHs first thing in the morning. And if their pH is too low or too high, we take steps to figure out A, why their pH is off, and B, how do we normalize it? Because they can absorb vitamins better at a normal pH. They can absorb minerals better at a normal pH. Everything functions better at that normal pH. The sicker patients are, the more their pH is off, with most cases of sick patients being acidic or low pH. So an acidic pH is associated with chronic illnesses such as arthritis, autoimmune disorders, candida, cancer, hormonal imbalances, and osteoporosis. And again, generally, the sicker somebody is, the lower their pH is. And one of the first things that I'll do is to assess why their pH is low and how to rectify that. One of my mentors in medicine, Dr. Majid Ali, said an acidic pH is a marker of the absence of health in the body, and I couldn't agree more with that statement. So refined foods are acidifying to the body. That includes all refined foods, such as refined sugar, refined flour, and salt. Now these items, unfortunately, make up the vast majority of our breads, pasta, and cereals. It's in pretty much all the packaged food sold in the majority of grocery stores around the country. These are because it contains these devitalized substances, refined sugar, salt, and flour. These are devitalized food. It lacks vitamins, minerals, and enzymes. The reason it lacks these items is the manufacturing companies know that they can sit on the shelf virtually forever. They don't go bad. Well, you can think, if you're going to eat devitalized food as a major part of your body, what are you going to get out of your health? You're going to get devitalized health and illness and generally lack of energy and poor health and poor immune system functioning. So the long-term ingestion of devitalized food leads to a devitalized body. And these things need to be avoided. And so I know we're going to focus on salt today, but I would tell you same holds for refined sugar and refined flour. I've written some, part of my health books have been on nutrition, and one of my books, A Guide to Healthy Eating, I talk about, the importance of avoiding these other refined items as well. Minerals are one of the most alkalinizing agents of the body. Remember, I told you that most sick people have an acidic pH or a low pH. So one of the things you want to do is what I want to do is to work to get their pH to come up, become more healthy. And one of the ways to do that is you need to increase their mineral intake. And nearly all patients with chronic illness are lacking in minerals, and converse of that is mineral deficiency will lead to an acidic state. So it's pretty much routine in my practice that I do check everybody's mineral levels when they first walk in the door. And one of the things I'm very passionate about is ensuring that my patients have adequate mineral intake in their diet and adequate mineral intake in their supplements, and that their testing shows that they have adequate mineral stores. And if they don't have adequate mineral stores, I am certainly all over them to start working on that. Now, you got to keep in mind, refined salt has no minerals in it. Unrefined salt has over 80 minerals in it. So what do you think, which salt products can be more alkalinizing to the body? It's not, it becomes a pretty simple question to answer, 30 minutes into this talk, where you might have not been able to answer that before we started talking about it. Sue is a patient of mine. She's 61 years old. She's a hairstylist who has stage 4 breast cancer. She developed numerous food allergies and couldn't tolerate supplements, was pretty ill and pretty fatigued, and developed a lot of pain from the breast cancer. When I had her check her pH of her saliva, it was consistently reading less than 6.0, which is all the pH paper went down to. Now remember, normal pH is around 7.2. She was very acidic. And I asked her to take an unrefined salt. Number one, I checked her levels, and her salt levels on her blood tests were low. And her mineral levels were very low. So I asked her to take a half a teaspoon per day of salt, and I had her measure it out and put it in a Ziploc bag and just sort of spread it throughout the day to get it in. And a week later, her pH rises from less than 6.0 to 6.6. Now, immediately when that pH went over 6.5, her food allergies improved and her energy improved. My experience with patients who suffer from various allergies, whether it be food and environmental, is that if their pH goes above 6.5, many of those patients' allergies settle down. Now, they can still be allergic to that product, but because they're functioning at a higher level, they won't feel the body won't respond to the allergy. They'll just be functioning at a better level. So what about myth 2? A low salt diet is healthy for you. This goes with chapter 3 in my book, Problems with Low Salt Diets. So I asked these two questions to start the chapter. Is a low salt diet helpful, or is a low salt diet healthy? And unfortunately, I'm sure you can answer. You can probably make a guess of which way I'm going to go with these answers of these questions. But let's show you. So is a low salt diet helpful? Well, conventional physicians, dietitians, the AMA, and most other mainstream organizations support a low salt diet. They say it lowers your blood pressure, that if you have blood pressure problems, it's because you eat too much salt on your diet, and that the best way to lower blood pressure is to lower your salt intake. But for the vast majority of people, a low salt diet does not result in a lower blood pressure at all. Do low salt diets decrease blood pressure? The literature is clear. Only in a select few individuals will a low salt diet result in lower blood pressure. These are salt-sensitive hypertensive patients. Very rare. You just don't see many of them. The vast majority of people can lower their salt to very small amounts in their diet. It's not going to change their blood pressure at all. And it's way less than 1% of these salt-sensitive hypertensive patients. My clinical experience has clearly shown no elevation of blood pressure with the use of unrefined salt. as part of a holistic treatment plan. In fact, hypertensive patients have been able to lower their blood pressure when a low-salt diet is corrected. A review of 56 hypertension trials showed a low-salt diet had a minimal effect on blood pressure in the vast majority of people. Wait till you see what effect that they had. The systolic pressure declined by an average of 3.7 millimeters of mercury. The diastolic pressure declined by an average of 0.9 millimeters of mercury. Now, I don't even know how you measure these little numbers, and these little numbers are nothing. Probably breathing, 2 breaths could probably change the systolic blood pressure by 3.7 and diastolic by 0.9. In 3,000 hypertensive patients were studied in this research study. The relationship between low-salt diets and cardiovascular mortality were looked at. And the authors reported a 430% increase in heart attacks in the group with the lowest salt intake versus the group with the highest salt intake. Well, hey, that's just the opposite of what they told us, that you lower your salt intake, you're going to lower your risk of hypertension, you're going to lower your risk of heart disease. Why would a 430% increase in heart attacks occur in the group with the lowest salt intake versus the group with the highest salt intake? And remember, these people weren't studying the difference between refined and unrefined salt. They were just looking at everybody with refined salt in their diet. I'll answer that question coming up. Well, if you recall, when Bill Clinton was running for his second election, and he was behind in the polls, he hired James Carville to come and manage his campaign, and James Carville told Clinton, it's the economy, stupid, and Clinton focused on the economy, and he won re-election at that point. Well, the answer to the question is simple if you say to yourself, it's the minerals, stupid. When I started using unrefined salt in my practice about 18 to 20 years ago, I started to see patients with high blood pressure lower their blood pressure. I started to see patients with fibromyalgia and other body pains and headaches and things like that, where their pains would get better as soon as I started to use unrefined salt in their diet. I saw patients with headaches and migraine headaches have their headaches markedly decrease or go away when they started to use unrefined salt in their products. I started to do some research and looking at their mineral levels, and it was almost like I hit myself on the forehead and said, it's the minerals, dummy. It's the minerals in salt that gives you the best effect, and I should have realized that before. But that's the real benefit of unrefined salt comes in. And that takes us to myth 3, low salt products are better for you. If we look at the correlation between minerals and cardiovascular mortality, low salt diets predispose to mineral deficiencies. That includes calcium, magnesium, and potassium. It also depletes B vitamins. This has been shown in many research studies. And many studies have confirmed that mineral and vitamin deficiencies have been associated with increases in incidence and mortality of cardiovascular disease. Low salt diets have been shown to cause significant increases in both total cholesterol and LDL cholesterol. My clinical experiences clearly show lipid tests improve when unrefined salt is added as part of a holistic treatment regimen. Now, elevated insulin levels have also been associated with an increase in cardiovascular risk. And this is, if you look around at our country and see how heavy we've become heavy because we're eating all this refined food that has thrown our insulin blood sugar curve off, and we're eating too much refined sugar and refined oil and refined salt, which is throwing off our insulin regulation in the body and causing our body to store fat. This is resulting in an epidemic of type 2 diabetes. And unless we get a hold of this, I suggest that this freight train of type 2 diabetes that's coming down the tracks is going to overwhelm our country fiscally. And I say that if Osama bin Laden was really smart, he would have just left us to ourselves, because we're going to eat ourselves into financial ruin unless we change some of our dietary habits. Now, these elevated insulin levels are associated with, as I said, diabetes, obesity, hypertension. They're all risk factors for heart disease. Insulin increases in the presence of a low-salt diet. That's been shown in numerous studies, including the study I've cited here from the Journal of Internal Medicine. So low-salt diets can lead to pH problems, acidity, an increased incidence of cardiovascular disease and mortality, poor lipid profiles, mineral and vitamin imbalances, and accumulation of toxic items in the body. So why would anyone want to eat a low-salt diet? Why would anyone want to promote a low-salt diet? The only reason they're promoting a low-salt diet is out of ignorance. They have no clue. That's what the research actually states it. So is a low-salt diet helpful? Is it healthy? The answer is no way. Low-salt diets fail to lower blood pressure in the vast majority of people, and the blood pressure lowering effect of a low-salt diet is minimal. And low-salt diets have been associated with adverse outcomes, including making the body more acidic, mineral deficiencies, poor lipid parameters, and increased insulin. The human body was designed to require and utilize unrefined salt to maintain a normal blood pressure, make food palatable, and supply the body with an adequate supply of minerals. And that brings me to Chapter 4 in my book, Hypertension and Salt, because I know there was already a question being asked about hypertension and salt. So let's cover that myth 4, salt equals hypertension. The InterSalt study. This was a study that really gave the impetus behind the U.S. government's push to lower our salt intake. And this occurred in 1984, and really since that time, it's like a freight train has left the station, and there's more momentum behind it than that you can imagine. And that's really where the claims of eating a low-salt diet or healthy for your diet has started from. So let's look back at this InterSalt study and see what it really said. It was 10,000 subjects. They were adults. 52 centers were studied over 39 countries. It was a worldwide study. The researchers looked at the relationship between blood pressure and electrolyte excretion in the urine. Electrolyte excretion was based with sodium levels in the urine. And a higher salt intake will result in a larger amount of sodium excreted in the urine. So across the population centers, 4 population centers had significantly lowered salt in their diet. And in these 4 population centers, they had significantly lowered blood pressure. And the blood pressure in these 4 centers did not increase with age, where in every other center, as the population aged, their blood pressure naturally went up. So researchers and academics seized on these results as a smoking gun that elevated salt was associated with elevated blood pressure. And really, that's what happened when the Surgeon General, shortly after the studies was released, went on national TV to talk about why we need to lower our salt intake as a country and we won't have any blood pressure problems. So what were these 4 centers that had lowest salt intake and the lowest blood pressure? They were Yanomamo Indians, a Zingu tribe, a tribe in Kenya, and a tribe in Papua New Guinea. These 4 centers were from non-acculturated populations. They were all jungle people. They didn't drink alcohol. There was no obesity in this population. And this population did not live to old age. They lived to a young age. Most of them died in the early 50s. So maybe their blood pressure didn't go up because they weren't alive. Now the Yanomamo Indians are interesting to me. I studied them at the University of Michigan. And my anthropology professor was one of the first anthropologists to visit the Yanomamo Indians. And he had written a book on the Yanomamo Indians and made us read his book, which was not a great book. Anyways, I learned more about the Yanomamo Indians than maybe I wanted to know. But the Yanomamo Indians, just like all those unacculturated people, rarely live beyond 50 years old. They don't drink alcohol, and they generally do not have obesity in their population. Is this who we really want to base the InterSalt recommendations from for the rest of the world? Now, there's no question that obesity and alcohol intake have been shown in many studies, including the InterSalt study, to correlate with the development of hypertension. I say that perhaps a lack of elevated blood pressure in these 4 groups were from the absence of obesity and alcohol intake. Or perhaps a lack of elevated blood pressure was because they didn't live that long. Now, further research into salt. 57 trials were reviewed over a 25-year period, and the authors found individuals with normal blood pressure who were put on low-sodium diets resulted in a decline of systolic blood pressure of 1.27 millimeters of mercury and a decline of diastolic pressure of 0.54 millimeters of mercury. Not much. And let me tell you, when you put someone on a low-salt diet, they're miserable. Their food tastes terrible. They get hungrier. They generally get heavier. They generally are eating more food because it doesn't taste right to them, and they're looking for the right taste in food. And they're generally unhappy people. So why would a low-salt diet be promoted if it promotes problems with cholesterol, LDL cholesterol, triglycerides, insulin, renin, angiotensin, and aldosterone? It results in an increase in each one of those factors that we don't want to increase in our diet. Now, the interesting thing is we have drugs to treat each one of these things as they increase. So perhaps there's a nefarious reason why these low-salt diets are being promoted, because there's all these drugs out there that can treat these things. So when you look at this slide, you see the things that low salt increases. I'd ask the question, why are low salt diets still recommended? Barbara's a secretary of mine, 53 years old. She's been on a low salt diet for 10 years. She came into the office one day and she had a sour look on her face, and Barbara usually doesn't have a sour look on her face, and I said, what's wrong? Barbara said that she went to her doctor. He measured her blood pressure, told her blood pressure was 165 over 100, and that she needed a blood pressure pill. He wrote the prescription out. He spent under 5 minutes with her and told her, you're going to be on this the rest of your life. I'll see you back in 6 months. So she wasn't happy about that. So I drew some blood tests on Barbara. She had a sodium level of 137, which was low. I say the sodium level should be at least 141 on patients. She also had low levels of magnesium, calcium, and potassium on testing, and low levels of vitamin C and D. So what did I recommend for Barbara? I gave her a half a teaspoon of unrefined sea salt, about 10 grams per day. I gave her a multivitamin and multimineral supplement. I put her on vitamin C. I told her to eliminate refined foods, including not only refined salt, I had her eliminate refined oils, refined flour, and refined sugar. Within 2 weeks of starting her treatment, her blood pressure fell to 110 over 70. Barbara had an increase in her energy. She did not need her blood pressure medication. We're 5 years later now, she still hasn't taken her blood pressure medication, and her blood pressure still stayed lower. Now, low-salt diets also cause problems. Low-salt diets will predispose people to getting cardiovascular disease. 2,900 mild to moderate hypertensive subjects were studied. They had a 24-hour urinary excretion of sodium, potassium, and creatinine, and renin were measured. After almost 4 years of follow-up, a 400% increase in heart attacks in men in the lowest versus the highest sodium intake group. Women, there was no difference. So for the governor of New York, for the mayor of New York, for the AMA, for the FDA, and all these nonsensical groups to call for a low-salt diet because it's going to improve our cardiovascular status, the literature doesn't even support them. The National Health and Nutrition Examination Survey is a study done by the U.S. government where they measure the mineral intake of a cross-population of about 8,000 to 10,000 Americans from east to west and north to south, and they extrapolate those numbers out nationally. And what they're looking for are nutritional intake, vitamins, minerals, and toxic elements in our bodies. After 30 years of NHANES data, they've clearly shown that mineral levels are correlated with elevations of blood pressure. In fact, treating elevated blood pressure is impossible without first evaluating and replenishing the body's mineral stores. My feeling is the first time you're told your blood pressure is high, you should have an evaluation undertaken that looks at your mineral and vitamin status, because usually that's one of the signals that your body is catching that's off, and it's elevating your blood pressure as a reason to perfuse your body because the perfusion has gone down due to your lack of minerals. So why is everything confusing? Why are these people saying you don't need salt and salt will lower your blood pressure, and here I'm saying just the opposite? Well, most of the studies have only looked at refined salt intake and its relation to blood pressure. They don't look at unrefined salt. Now, even when you look at refined salt, the same study holds true that you lower the salt intake, you don't decrease your cardiovascular risk, you don't decrease blood pressure in the vast majority of people, and there's really no good clinical effect to it, except for, and well, it's not an exception, well, the clinical result of lowering salt is increased insulin, triglycerides, renin, angiotensin, and things like that all require medicines. We've got to remember that refined salt is a devitalized product that has no use in our diet. Its use leads to multiple mineral deficiencies, as well as an imbalance in sodium with mineral intake, with different minerals. And unrefined salt with its full complement of minerals should be the salt of choice. So how much salt should you take? I say don't use any refined salt. It's related to the amount of water consumed, about a quarter teaspoon of unrefined salt for every quart of water ingested. And I do a lot of work with hormone balancing in my patients. And at the initial workup, everyone gets a hormonal evaluation, because I see so many patients out there suffering with hormonal imbalances, and if the hormone system is imbalanced, I find that their immune system can't optimally function, they can't feel their best. Well, my experience has clearly shown that unrefined salt provides the proper balanced minerals for nourishing the endocrine system. And minerals are necessary for the entire endocrine glands to function optimally. And in fact, my experience has clearly shown that unrefined salt improves all thyroid disorders. And in my thyroid book, I write that from somewhere between 40 to 60% of our population is suffering from thyroid problems. And the consequence of these thyroid problems are heart attacks, fatigue, fibromyalgia, chronic fatigue syndrome, cancer, everything that's afflicting us right now. So unrefined salt should be the salt of choice. There's no reason to use refined salt for any purpose. And Redmond salt is a good unrefined salt. It's proven its worth in my practice. I'm sure when you start adding unrefined salt into your diet, into your family's diet, you'll see good results in your health. So these, again, are the chapters in the book. I know we couldn't go through all of that today, but I hope I gave you something to think about with salt. And if you're interested in more, this is my book, Salt Your Way to Health. You can get that from the Redmond Company. You can also get that from my website, which is drbrownstein.com. And I'll stay for questions. And I certainly hope I've given you something salty to think about, and how to use salt in your family, and why you should use the right kind of salt, and why you should ask the questions. Are we talking about refined salt or unrefined salt? And now that you know the difference, you can refer to it appropriately and clean your cupboards out of the wrong salt and get the right salt in your house. So, thank you for your time, and I'll be happy to take questions.
All right, thanks so much. Thank you, Dr. Brownstein, for that presentation. That kind of concludes our formal presentation part of our webinar, and I want to remind you that we will be having a question and answer period of time. So as questions come into your mind, of course, you have that opportunity to write them down or to ask the questions online. Also, if you have questions, an easy way for you to do that is to raise your hand. That's next to your name, and we'll see that you have a question, and we can go right to you for questions that we'll be having in just a moment. I want to remind you also that a recorded copy of this webinar, including the question and answer period that we'll be having here in just a few minutes, is available for viewing on the website at Agri-Best Feeds, who is, of course, one of our sponsors here tonight, at www.agribestfeeds.com. is their website that you can go and listen to any previous webinars and also sign up for webinars. I'll show you that in just a moment as well. And speaking of sponsors, one of our other sponsors tonight is Real Salt, and we are pleased to have with us Daryl Bouchard with Redmond Trading Company, Real Salt, here to explain more about the Redmond Trading Company and the Real Salt products. And Daryl, if you are ready, I'm going to turn this over to you for a few comments as well.
Thanks, Scott. We have sure enjoyed being here tonight with Dr. Brownstein, and sure appreciate all of the comments he has said. The Redmond Company has a couple of different divisions. The one that we've talked most about tonight is our food product, which deals with human nutrition, like Dr. David Brownstein was just talking about. We also have our natural division that's more for the cattle and livestock and equine industries, and of course that's where Agri-Best comes into play. But just real briefly, wanted to talk on two things. First, we have a lot of people wondering where this deposit comes from, this real salt that was mentioned tonight. It's actually from an ancient seabed that was laid down long ago, before any of us were around. And the nice thing about that is it's a deposit. You can see a picture of the mine here. And it's been protected from all of the elements and the pollutions we have today. And it has an incredible flavor and all the essential minerals that were discussed by Dr. Brownstein. So it's a very great tasting, healthy salt, and just like you should be using it for your own use, it's the one that's you should have for all of your animals as well. Just in closing, we do have a few other fun Redmond products that we sell. We have a bentonite clay that we use for just about everything. That's a whole other seminar. And we have a coconut oil we bring in from Kenya. But we appreciate all of those that have joined us tonight. And Scott, unless you have any questions, I'll turn the time back over to you.
All right, appreciate that, and we're thankful to have our sponsors here tonight. They're without our sponsors, of course, it's kind of tough to put these kind of webinars on at this level and this caliber, and we're pleased to have our sponsors here tonight. And again, just to recap, our sponsors, Agri-Best Feeds, as well as the Real Salt, and if you have questions in regards to either one of those, of course, there's that opportunity that we'll be able to ask them questions as well. We're going to go ahead and take this opportunity now to open it up for questions. If you do have a question, I know several of you have voice questions through the type-in to the question area. We'll get to maybe some of those as well. You also have the opportunity to ask questions by just next to your name. You can press the little hand button, and we'll know that you have a question, and we can go right to you, and you can ask your question over in front of everybody here, so everybody can hear the question. A lot of times that helps to lead into other discussion in other areas as well. So I do encourage you to go ahead and do that as well. Want to remind you that as we talk about some of the different products here tonight and the books that we went over here today, Dr. Brownstein, there's ways that you can get those products. Of course, if you were invited by a dealer or somebody that sells these products, be sure to ask them as well for these products that you can purchase it from them. And of course, Agri-Best Feeds website provides a lot of information in which you can order information and get hooked up with dealers maybe close to you. We do have a pretty wide variety of folks joining us tonight from about 14 different states all across the country, so we welcome all of you and believe as we look at some of our questions here tonight, there's going to be some things in there that you can pull aside and utilize, of course. So with that, let's now take this opportunity for questions. I don't see anybody necessarily with their hands up, but I do see that we do have some questions in the column here. I'm going to take a look at some of these. The one question, this is from Linda Schillinger out of Illinois, and here is the question. I'll go ahead and ask it over air because it's probably applicable to or useful for other folks as well. The question is, will unrefined salt be good to reduce edema? The side effects of the medicine taken are not good. Would like to get off the medicine. If Redmond salt would help, how should real salt be recommended? What is the motivation behind people saying cut down on salt? So kind of several questions in there, and I know a lot of our panelists can see those questions, so I'm going to throw that out there. And for our presenters here tonight, Dr. Brownstein, do you want to have a first chance at asking or answering some of those questions or recapping? I know probably some of those you touched on through your topic or through your presentation tonight, but maybe to recap on some of those as well.
Well, to take the last part of the question, I think that there's a nefarious reason for promoting these low-salt diets is because it messes people's insulin and lipid panels and angiotensin and renin levels, and causing their triglycerides to go up and their insulin levels to go up and become diabetic, and then their blood pressure starts to rise when they go on these low-salt diets or reduce the salt in their diet. And there's a whole bunch of medications to treat each of those problems out there. So there's certainly a big pharma cartel reason to support and promote low-salt diets. Now, as the first part of the question about edema, I find many people get edematous with refined salt. I find they do not get edematous with unrefined salt. And very rarely will somebody develop edema from unrefined salt. And when they eliminate refined salt from their diet, when they add unrefined salt in their diet, many times edema goes away.
Okay, appreciate that. We have some other panelists joining us as well, so I'm going to flip over now. Neil Bouchard is joining us as a panelist, and Neil, you wanted to kind of maybe offer a few more comments as well to Linda's question.
Yeah, I think I'm on right now.
Yep, you are.
Regarding the water retention, I've had many women tell me that the Redmond Real Salt helped reduce their water retention. In fact, I've had some of them tell me that the Redmond Real Salt was the best diuretic they had ever found.
Well, my experience with my patients has been very similar. That what's happened is that one of the reasons the capillaries get leaky and you get edema is lack of minerals. Can't hold the blood inside the blood vessels, the small blood vessels, the capillaries, where it needs to go. And when you increase that, it's called osmolarity, and just put more minerals into circulation, and then you strengthen the blood vessels, they'll stop their leaking. So it doesn't. I wouldn't really refer to it as a diuretic effect. I would refer to it more as a healing effect. The end result is the same. The edema goes away and the vessels stop leaking. And it's really just a semantic thing whether, I say it doesn't have a diuretic effect and you do, but the end result is the edema goes away and people feel better. And that's been the same experience I've had with my patients.
All right. Great question. Appreciate it. We'll go to Linda again. You're actually, I see your hands raised, so I'm going to have you ask your question. I'm unmuting your microphone, and you can go ahead and ask your question here.
Okay, so this lady, she's in her 60s, and she called today about this real salt. Should she then maybe take a half a teaspoon each day? She has edema, or should she just get her white salt out of her refined salt out of her home and just start using unrefined?
Well, there's no question that for everybody out there, I don't care what their medical problems are, they should avoid refined salt or get it out of their diet and switch it to unrefined salt, period. Having said that, each patient needs to be, under the best circumstances, the patient should be evaluated to have their mineral levels checked and see where they fall. But, look, that's not going to happen for a lot of people. But there's no question in my mind that I tell the vast majority of my patients and new patients that see me, whether they have disease or they're healthy, to come in, from the beginning. When I drill their levels, their mineral levels and their salt levels, I tell the vast majority of them they're salt deficient. And from my definition of salt, when I use the term salt, if I say the word salt to you, or I'm lecturing to doctors, I always tell them right after the lecture starts, when I use the word salt, I'm using the word unrefined salt. So if you're not getting unrefined salt in your diet, by my definition, you're salt deficient. If you're not purposely putting it in your diet or eating food with it in it, then you're only eating food with refined salt, or you're eating a low salt diet. So therefore, by my definition, you're salt deficient, and you need to put salt in your diet. We function better with refined salt, and we function better with unrefined salt and using adequate amounts in our diet. That's how we were designed. That's what our genetic machinery requires. That's what our maker designed us for. That's why we have salt receptors all over our tongues, and why we want salt in our food. For those that haven't had unrefined salt, when you start eating Redmond salt and start cooking with it, your food tastes totally different. You'll never go back to refined salt because you'll start to realize that really had a tinny, aluminum, metallic taste to it that's not there in Redmond salt. Redmond salt makes food taste better.
All right.
Okay, thank you.
All right, thanks, Linda. Linda from Illinois joining us here tonight, so thanks for your question. We do appreciate that. Again, just all you have to do to ask questions, raise your hand next to your name. We'll know that you have a question. We can call on you, and we'll go from there. One other question, Dr. Brownstein, that we've got, this is coming through one of our panelists here, Brandon Foote, that is joining us with tonight. The question is, in your experience, how many minerals are in the blood of healthy people?
Well, there's hundreds of minerals in the blood of health. There's hundreds of minerals in the blood of everybody. There's optimal ranges of these things, and there's suboptimal ranges. The problem I'm finding with the vast majority of people is they're usually, life is not compatible with many of these minerals if you have zero. I mean, we can't live. Our enzymes don't function normally, or whatever. We'll run into problems. People generally don't have zero. They just have suboptimal amounts of these things. And when you have suboptimal amounts, the immune system doesn't function right, the organ systems don't function right, and it sets the stage up for disease. So really, that's what I'm talking about.
Okay. Thank you so much. Appreciate that. Again, we want to give everybody the opportunity to ask questions, so as you're thinking about questions, go ahead and raise your hand, or else you can type them out. We can go to you that way as well while you're thinking of those questions. I do want to add a couple words here from our sponsors tonight, and we've hit that a couple times. Our sponsors, Agri-Best Feeds, that are revolutionizing the livestock supplement industry by improving animal health and forage utilization while saving you money. And they are proud to introduce new nutritional technology that is a distiller's grain-based super fuel for livestock. They've got the Sweet Pro for cattle and the Equipride for horses. Unlike no other supplements, these products are not sugar-based, which means no molasses, and they contain a booster called probiotin, which improves feed digestibility by 25%. Agri-Best Feeds also carries the Redmond sea salt for livestock and humans. Redmond sea salt, as we've heard here tonight a little bit about it, all natural, unrefined product. The real salt product that we've heard some of the benefits about here tonight as well. For more information about Agri-Best Feeds, Sweet Pro, Equipride, and the Redmond salt products, you can stop into their world headquarters in Billings, Montana, and visit them there, or of course on the web at agribestfeeds.com. Agri-Best Feeds, super fuel for horses and cattle. Also, our other sponsor tonight, Real Salt. They're an all-natural, kosher-certified sea salt extracted from deep within the earth, crushed, screened, and packaged. Unlike Real Salt, other sea salts appear unlike other salts. Real Salt is with the other salts that are filled with silicates, dextrose, and other additives. That is not the case with Real Salt, and you will see for yourself when you take a look. So ask yourself, is your salt real, full of flavor, natural goodness, the way salt was meant to be savored? Experience the goodness of Real Salt. For more information, go to their website at realsalt.com. Well, with that, we're going to ask some more questions here tonight, and Irv Heidel is joining us, who's the president of Agri-Best Feeds. And Irv, I'm going to unmute your microphone, and you can go ahead now and ask your question.
I have a question with regards to for Dr. Brownstein. Would it be a healthy practice to, I saw at one point they're adding a quarter of a teaspoon of salt to a quart of water. Would that be a healthy practice for anyone to use on a daily basis?
All right, Irv. First off, tell me where you're from, and I'll answer your question. I'm just curious, where did you get the quarter teaspoon per quart of water?
I thought I saw that in the presentation. Maybe that was on a particular prescription that you had given. I'm not sure. I saw that in your prescription.
That's it. You know, I've been promoting that for a long time. That's why I was wondering if that's where you got it from. Yeah, that's about right. About a quarter teaspoon per quart of water. And one of the ways that you can ensure that you get the right amount of salt in is just add it to your water as you're drinking it during the day. Or what I sometimes have patients do is, generally most patients, I tell them a half to 1 teaspoon throughout the day. And I'll tell them to put it in a Ziploc bag and just sort of carry it with them, and then either eat it during the day, put it on your food, or put it in a water supply. But either way, that's about the right amount.
Thank you.
All right. Any other questions out there? We want to give everybody opportunity here to ask your questions tonight. You can do it a couple ways, of course. Raise your hand next to your name, or you can type your question out as well.
All right, I have a question.
You bet.
I have a question for Agri-Best. Are the animals fed with unrefined salt in their diet?
That industry-wide, that is true. That the refined salt is what is used widely in the industry. And as we have become acquainted with the Redmond sea mineral salt and have understood the benefits of the minerals and that synergy that's in the Redmond product, for example, we are seeing and, of course, are promoting vigorously the use of it in livestock, all classes of livestock, and quite frankly, for many of the same health reasons, of course, in some cases not as defined as you have with humans, but the response, health response, would be very similar in livestock. So we are promoting, and we do not even sell the refined salt at all. We promote only the unrefined salt minerals.
Was refined salt recommended for livestock in the past?
Could you repeat that again?
Was refined salt recommended for livestock in the past?
Yes, and it still is the salt that is mostly recommended in the feed industry today. The refined salt is, yes. But that is beginning to change as the benefits, such as the Redmond, are becoming being documented, and actually the use out on these ranches and the benefit that we're seeing with the use of the unrefined salt, the benefits are very obvious. So I think that's why we're so excited about promoting it both in livestock and, of course, in the human side as well.
So I would say to the listeners out there and to Agri-Best, if you guys have any, as you get information in or articles come out or people write in about their change with their animals with going from refined to unrefined salt, I'd be interested in that and certainly use that in my work and my writings. Because I know, just as I see the changes in humans, you have to see the changes in animals, and they have to do better, and they have to have a better immune system and a better ability to grow to the right size and to, function better with the right kind of salt in their diet.
There certainly is already quite a number of what I'd call testimonials and duplicating testimonials of these various health benefits of using the unrefined salt, and I'm sure that Redmond and of course Agri-Best as well would be very eager to forward any of this information to you for you to see some correlations between livestock and the humans in that regard. We can sure do that.
Great.
All right, great discussion. Appreciate that. Neil Bouchard, of course, with Redmond is joining us. We heard from him just a moment ago. And Neil, we're going to go back to you, maybe add a little bit more comment to this discussion we were just having in regards to the refined salt versus unrefined salt on the animal feed side of the industry.
Yes, that's an interesting question. So that question has never entered into the minds of anybody in the feed industry. Dr. Brownstein is in the forefront, in the health food arena, and he's not even on the radar of the feed industry. They think salt is salt. There's only one kind, and so they have no concept in the feed industry of unrefined salt. And so this is something that we at Redmond, I think, should do more and promote in the feed industry what Dr. Brownstein has been doing here. We've been selling, the concept of Redmond and its benefits, and it's true that, we have a stack of letters, several feet deep from livestock people who say that their livestock not only prefer the Redmond to any other salt, but then, they come back with health benefits. These minerals tip the scales in the animal's favor, and the livestock find the livestock owners find the health benefits coming to the animals, just like Dr. Brownstein has been talking about for people, and so we have been, promoting and saying, okay, these benefits come with Redmond, rather than distinguishing Redmond, the benefits coming because of refined salt. We have simply said they come because of Redmond salt, but it is something that we could do if we could, educate the industry that, the key is the unrefined idea. That would be good. Let's do that.
All right, great comments. Appreciate that, Neil. Thanks for joining us also tonight. We're going to go to a question. We've got, and I apologize, Patty, if I say your last name not correct here, but Patty Minrich out of Lake St. Louis, Missouri. And Patty, I'm going to go ahead and unmute your microphone, and you can go ahead and ask your question now.
Yes, I have an 11-year-old son who gets sinus headaches or allergy headaches, and he seems to be pretty healthy. And also my husband and me, we moved to Missouri, and we seem to get the mold with, I guess, our immune system is where we get the lightheadedness. And I also got nauseated. Will the sea salt help that? And if so, for my son, can he take it? And if so, how much?
Well, not only can he take it, you should be taking it. You should all be taking it. Will it help it? Yes, it'll help because it'll make your immune system stronger. But the other thing you can do is use the Redmond salt as part of a nasal rinse. And we use these rhino horns at our office, which are these plastic devices that you fill with warm water and you put a scoop of unrefined salt in, and then you rinse the sinuses out with them, and it works fabulous for people with chronic sinus issues, where the refined salt just doesn't.
All right. Thanks for your question, Patty.
It was one other question. Can you give this to dogs?
Well, yeah, you can give it to dogs. Now, one of the reasons I asked that question about Agri-Best is that I was wondering what they're putting in these animal feeds. And, I have a dog, and we buy organic food for her, and I got to look on the label. Now, I have given my dog salt. Of course, my dog seems to have the most sensitive stomach on this side of the Mississippi. And we got to be careful about how much salt we give her because she doesn't seem to tolerate it quite as well. So I don't know if she's getting too much in her food that we can't give her extra or not, but animals should have unrefined salt in their diet, dogs included.
And I have one other question. My pH balance, I had a really bad foot injury last year, so I was pretty much laid up in bed and couldn't walk for about 5 months, and then another 3 months, and I wasn't eating healthy. And I'm a pretty healthy person, but I kind of went downhill. And my pH balance, I just had my blood work done, was 8.0, I guess. And I started taking the real salt. Will this tremendously start getting better real soon? And it also...
What was the pH of?
The what?
What was your pH?
8. They said it was high. 8.0.
From what? What did they measure it in?
I don't know. They just said it was really high, and that's why my nutritionist put me on sea salt, but he didn't tell me what kind, so I just did my research myself, and so that's why I'm listening to y'all, and I just happened to get it.
Well, I'm curious. I don't know what kind of pH. It's not the blood pH because that's not measured normally.
Okay, I took blood work, and he just said my pH balance was really high.
I'm not sure what that means, but
okay.
I do think adding unrefined salt should be part of the diet. Unrefined salt raises pH. A pH of 8 would be your pH is too high, and I doubt that's the case. You don't see that very often in people. So I'm just not quite sure what pH they're talking about with that.
Oh, okay. He just said my pH balance, and he said this.
I thought he said pH was imbalanced. He probably meant your pH was imbalanced and needed to go higher. I'm assuming, because that's the vast majority of people.
Yeah, he said I think he said I was imbalanced. And he said I was imbalanced a little bit, and that the sea salt would nurture my body.
I think it's a good thing to add into your diet.
Okay. Thank you.
All right. Thanks, Patty. Thanks for joining us tonight as well. We welcome you on tonight's webinar. Appreciate your question and as well. So we have some more questions out there. Before we go to Marion, Neil, you had a comment in regards to dogs and salt. Are you there, Neil?
Yes, I think the listeners would get a kick out of this story. Years ago, we had an employee who had a little house dog at home, and this guy worked out in our warehouse, so he bagged salt with us, and so every night he would go home and of course had salt dust on his shoes, and this little house dog would just spend the night licking his shoes, and so one night he thought, well, boy, this dog must be really salt deficient. So he went to his cupboard and he had a container of Morton salt in his container. This was back in the 1960s, before we were doing salt for people. So he poured some Morton salt out in his hand, white refined salt out in his hand and offered to the little dog, and the dog wouldn't lick it. But then he took some of our unrefined salt and put that in his hand and offered that to this little dog, and who had been licking his shoes. And he offered it unrefined salt in his hand, and the little dog went to licking that. So that little dog could definitely tell the difference and had a preference for the unrefined salt.
All right, good. Appreciate that. All right, we've got some more questions here. We're going to go, and Marion Rhodes is joining us, and she asked her question, actually typed her question out. I'm going to ask it over air here, and we'll throw it out there for our presenter or panelists here. And that is that she's taken thyroid medication out for 25 years and started using real salt for 4 months, and since that time she has cut her medication in half. I guess it's more of a statement here rather than a question here tonight, but that was maybe a testimonial from her side of it, that been taking medication for thyroid for 25 years, and since adding real salt into her diet now has cut her medication in half. And so Dr. Brownstein, I don't know if you add any more comments in regards to that or not.
What happens is as the mineral levels come up, the thyroid functions better, and she's able to lower her thyroid dose. I totally agree with that. That's been my experience as well.
All right, appreciate that. Thank you, Marion. Appreciate you being on tonight's webinar as well. Any other questions out there? We want to give everybody ample opportunity, of course, for any questions that you might have. I want to remind you, too, that for any recordings of previous webinars that we've had that Agri-Best Feeds has been able to be a part of, you can go to their website, and of course there you can see on your screen is their website, www.agribestfeeds.com, and there you can go on and you can go in here to our links section right here and follow along as I do that, and that'll, if we scroll down in here, we can see various different things. One thing to point out, there is a spot on their website here if you're wanting more information about the Redmond Natural Trace Minerals. There is a video that you can watch and see a little bit more in regards to the Redmond Natural Trace Minerals, as we were talking earlier here tonight in regards to animal feed. That video there, of course, is a good opportunity to go and learn a little bit more about that. Also, of course, sign up for their newsletter. You'll hear about any upcoming webinars that they will be having. And, of course, at the top of the screen there, as you can see where my cursor is at, as I'm moving it around that register, that's for their monthly producer webinars that are going on each month. We have a cattle-focused webinar and a horse-focused webinar from our sponsors for tonight's webinar. We do have another question out there. I'm going to go to Dan temporarily, and Dan, I'm going to unmute your microphone, and now you can ask your question. All right, are you there, Dan? I see you've asked your question and you typed it out here, so I'll go ahead and ask it for you. Your mic is unmuted, so if you do want to talk, you're more than welcome to, but I'm going to go ahead and ask your question. And his question is this, and that is, how should you take the salt so that you know you are getting at least a half a teaspoon a day? Putting a half a teaspoon in water, is that, he wants to know, is putting a half a teaspoon in water, is that okay to mix in water?
Sure. You know how much you're getting, because what I tell patients is, I'll check their blood tests and ask them how much they're using. If they don't know, I'll have them start measuring it, and then it's nice to know how much you're adding in, because then you can adjust it up or down depending on what your blood tests show. But certainly you can add a half a teaspoon to water and sip it throughout the day. My suggestion is not to take it all at once. It's really, you can do it that way too, but I think it's better to spread it out throughout the day. You can put it in food, you can eat it, you can put it in water. It doesn't matter.
All right. Great question. Thanks, Dan. If you have any more questions, just don't be afraid to raise your hands. One quick kind of a question that was thrown out here, and that is swimming in the ocean water or drinking small amounts of ocean water beneficial in terms of getting your salt minerals into the body?
Sorry, can you say it again?
The question is swimming in ocean water or drinking a small amount of ocean water beneficial to you in terms of getting the salt and minerals into your body?
No. You don't absorb minerals through the skin. in any appreciable amounts. And ocean water has salt in it, but the salt content is way too low to get it from the water, and there's other things in ocean water that aren't healthy. So no, that's not a way to get salt in your body.
All right. All right, we're going to go to Linda Schillinger now. And Linda, I'm going to unmute your microphone. And if you have some questions, you can go ahead and ask them now.
Yeah, I have a couple, two for the doctor. We had bought one of those neti pots for my son. He has a lot of nasal congestion and things, and I wanted to use the Redmond in that pot. I wondered how much salt I should put in to do the nasal cleanse.
It's about 1/8 of a teaspoon.
Okay.
You could just put a pinch in there or 2 pinches in there if you don't have 1/8 of a teaspoon.
Okay. And if I wanted to do a detox, I have some chiros talking about using salt as a detox. How much do I use for a body detox?
Well, that 1/4 teaspoon of salt per quart of water is not a bad way to go. You know, I also have patients bathe with it, bathe in a cup of unrefined salt, and you know, and then put that 1/4 teaspoon in each quart of water. So that's very helpful for detox.
Okay. And then for Redmond, I recall you guys saying something about when they did an analysis on blood and then they did the analysis of the Redmond salt, there was a certain percentage of correlation there. Can someone talk about that a little bit?
I don't know as far as this is Daryl from Redmond, the correlation exactly from the two. However, as Dr. Brownstein talked in his presentation, natural salts have all the minerals that occur in the right ratios that occur in the body. So we haven't done, salt to blood analysis on our salt specifically, but there are a lot of studies out there that do link the two. Dr. Brownstein probably could talk more to that than I could.
There's definitely, there's not a lot of studies in unrefined salt. Most of the studies are in refined salt. There are studies on some mineral enhanced salt, but it's not unrefined salt. So unfortunately, there's not a lot of studies. I quote the ones that are there in my book, but it's just not a well-studied topic. I can just tell you clinically how it responds in my patients, which has been positive.
Okay. Thank you.
All right. Brandon Foote is joining us, and I'm going to unmute him. He's going to add a few comments here as well. Go ahead, Brandon. I've unmuted you there.
Okay, thank you. Linda, I'm probably the one who has made that comment about it. That research comes from Dr. Maynard Murray's book, Sea Energy Agriculture. Also, Charles Walters did a book on similar information called Energy from the Ocean Deep or something like that. So, that's where that information comes from, and they do say in there from their research that ocean water and blood in humans is very similar, minus the hemoglobin or blood plasma, something like along those lines. So that's where that comes from.
That's what I thought. I had heard it from you guys, but I just wondered. Okay, thanks.
All right. Thanks, Linda. Thanks, Brandon, for adding that comment as well. Linda from Illinois, as I said earlier. Dan asking our question earlier from Norfolk, Nebraska. So it's good to have folks all across the country joining us here tonight for our webinar. We're going to go to Irv Heidel with Agri-Best Feeds to add a few comments right now. Irv, you're ready to go.
Yes, Dr. Brownstein, I have another question with regards to the use of the unrefined salt in asthma. I've read in some different locations that there might be some benefit there for an asthma patient. What's your info on that?
No question. I wrote about that in my book. I have asthma. Whenever I start to wheeze or the asthma kicks up, the first thing I reach for is a 1/4 teaspoon of salt in a glass of water, and most of the time the wheezing will stop with that. The salt has properties to thin out mucous membranes and to relax airways that become spasmodic.
Thank you.
All right. Thanks, Irv. Irv is the president of Agri-Best Feeds. We thank Agri-Best Feeds, of course, for being one of our sponsors for tonight's webinar. And they've been one of the distributors here and marketing the Sweet Pro products, of course, for livestock, and of course then as well the Real Salt and the Salt Redmond Salt products as a distributing. They've got several dealers all across the region in which you can get a hold of them either locally or get a hold of them at their office. Go to their website at www.agribestfeeds.com, and there you can see on the top of your screen the toll-free number that you can call as well. Any other questions out there? We want to give everybody the opportunity here to ask questions that you might have. Just raise your hand, or we can you can type it in, either one. Also want to make sure that we thank our other sponsor as well. Real Salt is our sponsor of tonight's webinar. Full of flavor, natural goodness, the way salt was meant to be savored. Experience the goodness of Real Salt, and of course you can see their website on your screen now, www.realsalt.com, if you want more information about some of their different products. And of course, if you were invited by various dealer or dealer group here tonight, be sure you ask them about how you can get your products tonight. Their Redmond products. There's a variety of Redmond products that are available not only for livestock but of course for humans, as we talked about here tonight, and all the benefits of the benefits of Real Salt. And you can sure get a hold of your local dealer for more information on that. Kind of getting things kind of wound down here. If you have any questions, you will still have that opportunity. I'm going to now turn it back over to Irv Heidel for a few comments here tonight.
Thank you. I sure want to thank Dr. Brownstein for this very thorough and fine presentation here. Very, very helpful and very, very informative and educational, and I just want to give you a special thanks. And then, of course, the folks at Redmond as well. We just appreciate our working relationship with them and the fine product that they are making available for us and people all across America to market and distribute. Just want to say a special thanks to all of you.
All right, thanks, Irv. And again, just one final thank you to our sponsors. Agri-Best Feeds offer a unique line of livestock supplementation. It's a distiller's grain-based complete supplement, as well as sea salt for horses and cattle. We welcome Agri-Best Feeds and thank them for their sponsorship here tonight. And, of course, also the ability through them to get some of the human salt, the Real Salt products as well. Make sure you contact your local dealer. And also sponsoring tonight, Real Salt. We thank them for their sponsorship as well and appreciate their help and cooperation for tonight's event. Well, on behalf of our sponsors here tonight, we thank you for joining us, and I want to remind you that you can go to the website at www.agribestfeeds.com to hear a recorded copy of tonight's webinar. We do want to thank our presenter tonight, Dr. David Brownstein. You can go to his website at drbrownstein.com for more information. Well, thank you, and we'll see you next time. Thanks for joining us on tonight's webinar. My name is Justin Mills, and we'll see you on the next one.
Thank you.